Good afternoon. My name is James Stanger, and this is another video on my Piezo-ICSI series based on a publication that came out today from Japanese authors in JAG, Pregnancy and Perinatal Outcomes Following Piezo-ICSI with Vitrified Warm Single Blaster Transfer, a Retrospective Cohort Study. And the reason for this is following the publication for the Xander Fox information, there was an editorial in the Fertility and Sterility toward walking on eggshells. And one of the things they made, one of the comments they made in that commentary, which is worthwhile reading, actually, it's a good one. I recommend you will do that. There's one factor limiting the clinical use of Piezo-ICSI has been the concern regarding the safety of the operation fluid and the technique itself. Early studies used mercury or fluorinet as the operational fluid, leading to concerns about the safety of the procedure. To address this, the Xander Fox, which I discussed in my first video on this thing, which by the way is the most popular video I've made. It has by far and away more hits and more views than any other video that I've made, some of which have had very few, I must admit. But the Piezo-ICSI one is by far my leading one and continues to attract views every day. So clearly it's a topic of considerable interest to a lot of people, and rightly so. And in that video, I discussed Xander Fox's data, which is very impressive. But their results are promising with no adverse fetal outcomes reported using this alternative fluid. However, more studies should be performed to validate this safety, as well as the general safety of Piezo-ICSI in general. So that was in 2024. And this paper is basically addressing some of those issues. It's still coming from the main Japanese clinic, and it does need to be reproduced in many other clinics. But I think this is a positive start. So what did they say? Their objective was to report pregnancy and perinatal outcomes following ICSI using the piezo element in a large Japanese cohort undergoing vitrified warm single blaster transfers. Outcomes from conventional IVF were included as a reference point, showing similar ovarian stimulation and embryo transfer protocols. That's because they don't do ICSI. All their ICSIs are done with piezo, so they're comparing it to IVF rather than the standard ICSI technique. And their conclusion is that it was associated with a favorable pregnancy and perinatal outcomes in women aged 40 years or under. So their data in a summary was in the Piezo-ICSI cohort, the clinical pregnancy rate was 50% and the live birth rate was 38%. Among live births, the mean birth weight was 3,000 grams, gestational age 38 weeks, and congenital abnormality rates less than 1.5%. These outcomes were comparable to the ICSI reference population of the similar sort of pregnancy rate, 38 to 48%, live birth rate of 38%, and birth weight 3,200 grams, and a congenital abnormality rate of 2.5. So in this particular cohort, the congenital abnormality rate was a little bit less, but in fact, the numbers are so small, it doesn't make a great deal. But still worthwhile noting. But what's interesting is the proportion of female infants was significantly higher in the piezo group, 53% compared to the IVF group. And that's something which we can discuss a bit later on. But I think I'll do a separate video on it maybe next week or when I come back from India. So what does the data show? So there are several tables they presented on. It's an open access article, so I'm going to reproduce it. Basically, this is the data they presented. The piezo group, 1,800 cases, which get to be a considerable number, and they had a reference population of 1,700. And I like these sort of publications because it's basically showing that there's no difference. Biochemical pregnancy rate was the same, clinical pregnancy rate was the same, live birth rate was the same, the miscarriage rate was the same, and the ectopic pregnancy rate was the same. So the authors made the comment these outcomes were comparable to the IVF reference population, which I agree with. The second one was looking at the perinatal outcomes. Once again, you're only looking at a smaller number, only 700 births compared to the IVF group of 644. But as you can see here, cesarean section rates were the same as you'd expect. Complications were the same. Preterm deliveries were the same. Live birth weights were the same. Gestational age was the same. Fewer males and more males. And the abnormality rate is what we had before. So really, on this prima facie set of data of 700 odd births, you can't show there's no inkling that there is something amiss. Doing a sensitive analysis, if you restrict each patient to its first FET cycle, including 930 Piezo-ICSI, and 971 IVF ones. The clinical pregnancy rate, the age was the same, clinical pregnancy rate was the same, live birth rate was the same, live birth rate was the same, and the incidence of females was higher than in IVF. Interesting. I think if you wanted to have female babies, maybe you should do Piezo-ICSI. Maybe not. Again, but then a sensitivity propensity score where they're matching it case by case. Once again, there is no difference except the gender. It really is quite remarkable that it's so different. They do note here that clinical pregnancy rate was a little bit higher, right? But that I think is, well, that's just statistics for you. The bottom line is this: 37.1 to 37.9. Exactly the same. Quite remarkable. And if they did the study comparing the stratified analysis with male infertility compared to non-male infertility, basically the results are the same. For the ones with male infertility, 50% to 50%, 39% live birth rate, and likewise with the non-male factor IVF cases. And doing a multivariate logistic regression analysis after adjusting for maternal age, transfer number, day 6 embryos, and hormone replacement cycles, the odds ratio for Piezo-ICSI against IVF was the same. Okay, so these are the author's comments or conclusions. And I don't mind, I think these videos are quite good, or basically if it's an open access article, I can just reiterate what the authors are saying because they are concise and I don't want to misplace them, but I will add one comment of my own at the end. So the author's conclusions. This large retrospective cut study reports favourable pregnancy and perinatal outcomes following Piezo-ICSI in women under 40, undergoing vitrified warm single bus transfers. The live birth rate of 38% and congenital abdominal rate of 1.6% are within the expected ranges for RT. These outcomes were comparable to a reference IVF population undergoing similar ovarian stimulation and embryo transfer protocols. Our finding of a significantly high proportion of female infants in the Piezo group compared to ICSI is consistent with previous studies comparing ICSI and IVF. That's something which is probably a bit of debate. I'm not quite sure every study shows that. This phenomenon has been consistently reported across multiple studies and is thought to be related to differential survival or selection of egg-bearing sperm. The consistency of this finding across all genetic approaches supports its validity. I think there's something we just need to keep our eye on here. It may well be that there's sort of something funny going on with whether it's an X or Y bearing sperm which is able to initiate things that lead to pregnancy. So, but at the moment, I don't really understand it. But there is the potential that if the sperm are handled in the right way, then maybe the X-bearing sperm consistently produce more live births. And then the authors address the issue of the Fluorinet. The safety of Fluorinet FC77, the operational liquid used in Piezo-ICSI, has been raised as a potential concern. However, our favourable pregnancy and perinatal outcomes, together with previous reports, suggest that this does not adversely affect short-term clinical outcomes. At the same time, because our study does not assess long-term offspring health, potential long-term effects cannot be excluded. Excuse me. This is where you need a glass of wine. That's better. So this study has several strengths. It represents one of the larger cohorts reporting pregnancy and perinatal data following Piezo, and the use of multiple sensitivity analysis enhances the robustness of our findings. The consistency of results across these approaches provides strong evidence supporting the safety of Piezo-ICSI. The real data will come when other groups, not only Monash, but other groups in Europe start exploring this technique and aggressively testing its efficacy. And I think you're going to find an interesting outcome. In conclusion, this large retrospective, so this is the author's final conclusions. In conclusion, this large retrospective cohort study demonstrates favorable pregnancy and perinatal outcomes following ICSI. The live birth rate, gestational age, and congenital abnormality rate were within expected ranges and comparable to those observed in a reference population. These findings support the clinical utility and safety of Piezo-ICSI as a fertilization method and assisted reproductive technology. Further prospective studies with long-term follow-up of offspring are warranted to confirm these. What I find interesting, though, is that the piezo doesn't make it better. In a funny sort of way, the results are so consistent between the two that you really have to say, well, maybe the current technique is okay, so why bother changing? But one clue of where I think we're going is this study you're looking at robotic IVF published in Fertility and Sterility late last year, using the group setting up the robotic IVF. They used a fully automated ICSI system developed using off-the-shelf components, including inverted microscope, heater stage, and the piezo actuator from Piezo Expert of Evendor. And their conclusion, the ICSI automated system demonstrated efficacy and precision in performing critical procedures with human supervision. The system met or exceeded most predefined performances criteria, with minor deviations in sperm deposition success rates and procedure times. These results support the validation of the system as a promising automated solution for performing ICSI procedures in clinical settings with potential standardized outcomes and reduced operator intervention. Now, I think these observations for the robotic system will apply on the bench using standard skilled embryologists. So my comment is this: I continue to be impressed with the Piezo-ICSI. There's a spelling mistake there. Process mainly because it is less brutal than ICSI, which in many hands is scary. If you watch some people doing ICSI, sometimes it is, some embryologists are just so skilled at it, the needle just slides in, slides out. But there's huge variation in embryo in oocyte quality. But in other hands, it's actually fairly brutal. So I think the Piezo-ICSI would add a degree of uniformity to the injection process that will, going forward, be better than the current oocyte distorting techniques, which haven't changed in all fairness over 40 years. Knowing what critical events that are occurring in the zygote that influence the live birth rate, and I've done a couple of videos on that. I should have put a notice on here that you should go back and look at some of the other ICSI videos I've done. Does suggest that the delivery of sperm should be welcomed. There's one fantastic study where many mice looking at protein symmetry, protein synthesis in the new zygote, and it produced this whole range of different sorts of proteins that spread across the oocyte, all focusing on where the sperm is deposited. And being more particular about the deposition of the sperm may, in turn, over the long term, demonstrate that the piezo is at least as good or better. But then I make the point. The argument that the results are similar, so why change, in my view, is a regressive thought process. And even though the results are the same, then this is the main reason to move to Piezo-ICSI, and that's it. Just because it's the same is not a self-evident reason for not doing it. If it is the same, or maybe slightly better, then that's a reason for doing it, because if it is no worse and it's a better technique, then maybe you should move it. But it does give you the forward movement of trying to automate it in some way. So I'm a strong supporter, depending upon more perinatal outcomes. So that is the video. My name's James Danger, and with more 50 years experience. This is not medical advice, but it may help you knowing what questions to ask about your treatment with your doctor, and maybe to help in understanding the advice you receive. So if you're going through an IVF clinic whether using my Piezo-ICSI, this video may help you understand some of the reasons why you may like to consider it. And once again, my videos are supported by my Third Aid EQA site, which is an online EQA program in andrology and embryology. And like always, I always finish with this slide. I'd like to thank you. I know IVF is a personal journey that involves the action of many techniques, ideas, people and staff, and this is one. This is a classic example. It helps to understand all aspects of that journey. I hope this information may be of value. If you like it, please tell other clients and subscribe. Thank you and good night.